Mr. Harry, I'm pleased to inform you that your surgery was a success. The tumor was removed completely, and there were no complications.
That's excellent news, Dr. Mihira. I'm relieved to hear that.
Now, let's discuss your recovery. You'll need to stay in the hospital for a few days for observation. We'll monitor your vital signs and ensure you're healing properly.
How long will it take to recover fully?
Recovery time varies depending on individual factors. It may take several weeks for you to fully heal. During this time, it's important to follow your doctor's instructions regarding wound care, medications, and activity restrictions.
Will I be able to return to work soon?
It will depend on the nature of your job. We'll discuss a return-to-work plan and provide specific guidelines.
I'm concerned about the scar. Will it be noticeable, Dr. Mihira?
The scar will fade over time, but it may be visible. We can discuss options for minimizing the appearance of the scar, such as scar creams or treatments.
MIHIRA, here's a compassionate, cohesive explanation with self-care advice. When dealing with an infected finger, the most important thing is to care for it gently and consistently to help it heal properly. Start by keeping the area clean. Wash your hands regularly with mild soap and warm water, and avoid touching the infection unnecessarily to prevent spreading bacteria. Soaking the affected finger in warm, soapy water for 10 to 15 minutes a few times a day can help reduce swelling and draw out any trapped pus. After soaking, gently pat the area dry with a clean towel and apply a thin layer of antibiotic ointment to fight infection. Cover it with a sterile bandage to protect it from dirt and further irritation. Be mindful not to put pressure on the finger, as this can worsen pain and slow down healing. Avoid activities that strain the area, like typing, gripping objects tightly, or wearing tight gloves. If you notice increased redness, throbbing pain, or spreading warmth around the infection, it's important to see a doctor, as these could be signs that the infection is worsening. Resting the hand and keeping it elevated when possible can also help reduce swelling and discomfort. Remember, healing takes time, so be patient with yourself. If the infection doesn't improve within a few days, or if you develop a fever, seek medical attention promptly. Taking these small but careful steps will support your recovery and help prevent complications.